High blood pressure, also known as the silent killer, affects millions of people worldwide and is a leading cause of serious complications like heart attacks and strokes. The most concerning thing is that many people don't know they have high blood pressure or make mistakes that worsen their condition. In this video, we'll explore the 7 most common mistakes that people with high blood pressure should avoid at all costs. By learning to identify and correct them, you can protect your health and improve your quality of life. Follow along and find out how. Mistake number 1: stopping medication when blood pressure is controlled. One of the most common and dangerous mistakes people with high blood pressure make is stopping their medication as soon as their blood pressure returns to normal. This mistake may seem logical at first glance, but in reality, it poses a great risk to your health. Controlled blood pressure doesn't mean that hypertension is gone, it just means that the medication is working. By stopping your medication, you expose yourself to a rebound effect, which can lead to a sudden increase in blood pressure, accompanied by serious complications, like heart attacks, strokes, or even kidney failure. Many people think that it's enough to measure their blood pressure in the morning and get an ideal value, like 110/70, to skip their medication that day. However, this assumption is completely wrong. Modern hypertension medications are designed to control blood pressure continuously over an extended period, not just at the time they are taken. Additionally, these medications tend to normalize blood pressure rather than lower it excessively. Therefore, there's no reason to fear that your blood pressure will drop too low. To avoid this mistake, it's crucial to meticulously follow your doctor's recommendations. Medications should be taken every day, at the same time, regardless of your health condition or blood pressure at that moment. In case of side effects, or if you believe the dose is too high, consult your doctor to adjust the treatment instead of stopping it on your own. In the fight against hypertension, consistency and discipline are your best allies. Mistake number 2: relying only on medication and neglecting lifestyle. Another common mistake among people with hypertension is assuming that medication is a miracle solution that allows them to maintain their unhealthy habits. While medications are an effective tool in controlling hypertension, they are not enough on their own. Ignoring the impact of your lifestyle on your blood pressure can negate the benefits of treatment and put your health at risk. One of the most important factors to consider is diet. Excessive consumption of salt, processed foods, snacks, and sugary drinks contributes significantly to increased blood pressure. A diet rich in fruits, vegetables, and low-sodium foods can make a difference. Regular physical activity not only helps reduce blood pressure, but also improves overall cardiovascular health. Walking, swimming, or practicing yoga for at least 30 minutes a day can be a valuable addition. Stress is another silent enemy of hypertension. If you don't manage your stress levels, medication alone won't be enough to protect you from long-term damage. Relaxation techniques, such as meditation, deep breathing, or simply spending time on enjoyable activities, can make a difference. Getting enough sleep also plays a crucial role in controlling blood pressure. Sleep deprivation can lead to hormonal imbalances that increase blood pressure. In short, medications are important, but they must be combined with a healthy lifestyle. A balanced diet, regular physical activity, adequate rest, and stress management not only improve hypertension, but also enhance overall quality of life. Mistake number 3: adjusting medication on your own. Changing the dose of your medication without consulting your doctor is a mistake that puts the health of people with hypertension at risk. It's common to hear stories of patients who, seeing that their blood pressure remains high, choose to double the dose of their medication, hoping for better results. On the other hand, some reduce or stop treatment because they feel they no longer need it. Both decisions are equally dangerous. Increasing the dosage without medical supervision, in addition to potentially causing serious side effects, such as dizziness, extreme tiredness, or even fainting, can overload the body. For example, some people think that taking twice their usual dose of medication will help them lower their blood pressure quickly. However, many medications have a maximum dose that, if exceeded, will not bring any additional benefit, but will only increase the risks. On the other hand, even reducing or stopping treatment without a valid reason is very harmful. Hypertension is a chronic disease that requires long-term treatment. Medications are not intended for occasional use, but for a complete and continuous program. Sudden interruption can cause a sudden increase in blood pressure, the so-called rebound effect, which greatly increases the risk of cardiovascular disease. The only safe way to adjust treatment is under the supervision of a doctor. If you feel you need to change your medication, schedule an appointment with your doctor and express your concerns. Remember that self-medication is a dangerous practice that can put your life at risk. Mistake number 4, measuring blood pressure constantly. While it's important to monitor your blood pressure regularly to keep your hypertension in check, measuring it too often can negatively affect your physical and mental health. Many people become obsessed with measuring their blood pressure several times a day, especially when they experience symptoms like headaches or anxiety. This practice, in addition to being useless, can generate stress and worsen the problem. If you're constantly worried about your blood pressure readings, you're likely suffering from white coat syndrome. This is because stress and anxiety can temporarily raise blood pressure, creating a vicious cycle where the fear of the result ends up causing the very problem you're trying to avoid. Additionally, this obsession can lead you to misinterpret the results. For example, a temporary increase in blood pressure after exercise or a stressful day doesn't necessarily mean a serious problem. To avoid this mistake, set a fixed schedule for measuring your blood pressure. In general, it's sufficient to measure it twice a week, preferably on alternate days and at times of tranquility. If your doctor recommends it, you can do it less often, for example, every fortnight. The important thing is to take the measurement under ideal conditions. After 5 minutes of rest with your arms supported and without having smoked, drunk coffee, or exercised in the last half hour. Remember that a single value doesn't define your health status. What matters is the average of your values over time. If you notice inconsistent results, write them down and consult your doctor instead of worrying unnecessarily. Tranquility is essential for keeping blood pressure under control. Mistake number 5, not measuring blood pressure or measuring it incorrectly. The opposite of the previous mistake is not measuring blood pressure as often as necessary or doing it incorrectly. Many people don't measure their blood pressure regularly because they think that, in the absence of obvious symptoms, there's no cause for concern. This is a serious mistake, as hypertension is a silent disease that can damage vital organs, such as the heart, kidneys, and brain, without any visible signs. Measuring blood pressure is the only way to know if treatment is working and if blood pressure is back to normal. Without this information, you would be navigating blindly, which can have serious consequences. However, just as it is important to measure blood pressure, it is crucial to ensure that the measurements are accurate. Using an uncalibrated device not following the instructions for use, or measuring blood pressure at an unfavorable time can distort results and lead to wrong decisions. To measure blood pressure correctly, use an approved blood pressure monitor and follow this procedure. Sit comfortably with your back straight and your feet flat on the floor. Make sure the cuff is placed on your upper arm at heart level and avoid crossing your legs or moving during the measurement. Take at least 2 measurements to confirm the results and record the average value. Measuring blood pressure correctly and regularly is a simple but essential habit for managing hypertension. Make this gesture a reflex and you will take an important step towards a healthier life. Mistake number 6, believing myths and false information. In the age of technology and social media, it's common to come across misinformation about hypertension. One of the most persistent myths is that of relying on smartphone apps or uncertified blood pressure measurement devices. These tools are often inaccurate and can give a false sense of security or generate unnecessary alarms. Another unfounded belief is to believe in miracle cures that promise to cure hypertension without resorting to medication or lifestyle changes. The truth is that hypertension is a complex disease that requires a scientific and evidence-based approach. Smartphone apps that claim to measure blood pressure simply by touching the screen with your finger are not accurate enough to replace a certified blood pressure monitor. Additionally, resorting to home remedies without consulting a doctor can delay the start of proper treatment and worsen your health condition. To avoid this mistake, get information from reliable sources such as doctors, recognized health institutions, and scientific publications. If you find information on the internet, verify its truthfulness and consult a healthcare professional before making any decisions based on it. Remember that when it comes to health, there are no shortcuts or miracle solutions. Mistake number 7, underestimating hypertension because it's silent. One of the biggest mistakes people with hypertension make is not taking their illness seriously because they don't experience any obvious symptoms. It's no coincidence that hypertension is known as the silent killer, as it can cause serious damage to organs such as the heart, kidneys, and brain without any obvious signs. Many people only find out they have high blood pressure after suffering serious complications such as a heart attack or stroke. It's crucial to understand that the absence of symptoms doesn't mean being healthy. Hypertension affects the health of blood vessels, making them stiffer and increasing the risk of long-term cardiovascular disease. Therefore, it's essential to have your blood pressure checked regularly, even if you feel fine. This way, you'll be able to detect changes in time and take the necessary steps to manage your blood pressure. If you don't remember the last time you had your blood pressure measured, do it today. Prevention is key, and, in the case of hypertension, a small gesture can make a difference in the quality of life. Hypertension is a serious condition, but with proper treatment, it's possible to keep it under control and avoid serious complications. Avoiding these 7 mistakes is an essential step to improve your health and live better. Remember that discipline, accurate information, and a healthy lifestyle are your best allies. If you liked this video, share it with your loved ones. See you in the next video, and let's take care of our health together.